Last week was the start of large-scale use of the Pfizer vaccine, mainly in frontline healthcare workers.
And our very own Dr. Frank McGeorge works in the emergency room at Henry Ford Hospital and received his shot Thursday. He joins us live. Frank, last we heard you felt fine, but what happened?
Yeah, Kim and Jason. So the last time I was on air, Thursday night, I had received the vaccine about 3 hours before, and I was feeling fine. But then about 2 hours later, so 5 hours after the shot, I felt like my arm was hit by a hammer, and that lasted about a day. Now, I didn't have any other side effects, so from my experience, I would just say, don't plan on any heavy lifting for a day.
No matter which vaccine you receive, Pfizer's or Moderna's, I would suggest that everyone who receives a vaccination should sign up with the CDC's After Vaccination Health Checker, vSafe. It's a smartphone-based tool that sends you a text message when it's time to check in and report any symptoms or side effects. They ask for your name, phone number, date of birth, gender, and zip code. Once a day for the first week, you'll get a daily reminder link that takes you to a page where you can report any symptoms. After the first week, you'll get a text once a week for 5 weeks. The program is really important to help the CDC and FDA identify any adverse reactions as quickly as possible. According to the CDC, as of 1 p.m. yesterday, 556,208 doses of the vaccine had been administered, well over 10 times the number of people in the original Pfizer trial, making this the best opportunity to quickly spot any new problems.
Now, I brought up my sore arm not to dissuade anyone from getting the vaccine, but just so you know what to expect. Now, I also want to address a viewer question. I've had a couple of people who are in the freshly determined 1B essential worker category essentially ask if their family would be eligible for vaccine when they get it, especially because they have a family member who might be at medically higher risk of developing severe disease. Unfortunately, the simple answer about the family plan, so to speak, is no. Right now, vaccine eligibility is limited to individuals. The idea, of course, is that by protecting people who are at high exposure risk, you are basically also decreasing the exposure risk of the entire family.
Yeah, okay. Well, Frank, we're glad that you're okay, that it was just a very sore arm. But I want to ask you something. We haven't heard a word about the flu. Has flu season started? Have there been any cases yet? Any update on the flu?
Yeah, so far, the Michigan Department of Health is only reporting one case of H3N2, which is a swine flu variant, and that's actually consistent with what the rest of the country is seeing. Basically, at this point, minimal to no flu activity, which is really good news.
Interesting. Okay. Dr. McGeorge, thank you.